So Jeff, as we think about the overall expense management and margin improvement within healthcare, in terms of the overall hospital operating budget, lab seems to be a very small portion of it. But I know we've talked in the past about how it can have a huge impact on the overall operating margin.
Well, Mike, it really can. And I think in terms of statistics, one might say that lab expense is 5% of a hospital's operating budget. But when you think in terms of hospital operating margin, after all of its revenues are received, its expenses are paid out, operating margins can be as low as 3 to 5%. So while the operating expense budget for a laboratory may only be 5% of the overall spend, improving that expense by 10% has an exponential effect on the operating margin because it all drops down to the bottom line. And where do we see some of those opportunities? If you think about laboratory spend, 80% of lab expense is tied to salary and benefits, supply cost, as well as reference testing. So as you're talking with some of the individuals, some of the executive team members, hone in on some of the things that we've been able to do through our collective years of experience to really drive opportunity in those three key areas.
Yeah. So kind of like the 80-20 rule, where 20% of the opportunities are going to drive 80% of the improvements.
Exactly, and we see a lot of that in labor. There's always opportunity for consolidation of services, process redesign to make sure that we're practicing best standards, supply expense, looking at pricing agreements, ordering practice, again, process review to make sure that supplies are not expiring due to end of life, and making sure that we're not losing a lot of supplies through poor quality. People don't understand the cost of quality. Poor performance, having to repeat testing, has a significant negative impact on the operating expense line for the laboratory. Finally, reference testing. Reference testing with the new technologies, especially in molecular diagnostics that come in every day, every month, we see a significant increase in the spend in the reference testing area. And one of the things that we have found is that many organizations have not gone back to the market in terms of looking at their pricing, doing what we would term a request for proposal to make sure they're getting best prices. Doesn't always mean you're going to change reference laboratories, but you need to set a stage of competition so that you can ensure that you're getting the best price.